I've wanted to come for a while. I work for Cancer Research UK. I'm one of the nurses on the inquiry service there. People ask us a lot of questions about cancer and also about research into cancer.
So people from all over the world are coming around to give their presentation, so this will give me a good idea what is happening around the world, and it will take us outside of what we do in our labs.
Well, the NCRI Conference is really a unique conference. It brings together researchers from across the cancer research spectrum, from very basic researchers trying to understand the mechanisms that underlie cancer development, right through to clinicians who are using this knowledge to develop new potential therapies and testing those in the clinic. So it's a conference that really brings together the whole church of cancer research in this country.
We've attended the conference pretty much every year since it started. First few years in Birmingham, now in Liverpool. We get to meet a good mix of basic scientists, group leaders, PhD students, research technicians, but also a wide range of other people involved in sort of cancer research.
Very modern building, very in keeping with the NCRI meeting in terms of where it's moving to. Very easy to get to, and the car park access and things like that will make it very easy. A lot of new faces, new people that we meet, a lot of surgeons and clinicians that we don't normally get access to. So it's a great opportunity for us to interact with those people.
But you get 3 or 4 days of very, very high quality delegates, lots of them, and the facilities and the organisation of the conference are excellent as well. So it makes life nice and easy, and we get lots of business out of it.
This choir is all people who've been affected by cancer. The choir itself started life as a research project. So we started off looking to see whether the choir could help improve people's quality of life, their health and well-being. We've shown that we've got improvements in vitality, social function, emotional improvements, reduction in anxiety and depression. But really, just the great thing is the stories of the people themselves, how it's improved their lives, and the wonderful sound they make.
I was chatting to one of the guys that has been quite poorly, and he said that the choir is the only thing that he did that week, but he did something. He got out and he saw people and he got engaged by doing something. It's just so powerful to know that you're making that much of a difference to an individual's life. So it's a truly wonderful experience to be involved in.
It was just magical, and I think everybody who was there went away thinking, gosh, isn't this wonderful? And that's what it's all about, improving the quality of life for people across this country and the world.
We've had some really fantastic sessions already. This morning we had Bob Weinberg and Doug Hanahan talking about the hallmarks of cancer, 10 years on from a seminal review that they wrote, which really changed our thinking about cancer. It really crystallized our thoughts about the different properties that cancer cells have and the importance of those properties in terms of development of cancer.
As many people will know, Roche are the leading oncology company in the world, and our presence in the UK is such that it's very important that we feel that we should support the NCRI at their national meeting. It's great to be in Liverpool. It's a new venue. I mean, we've been in Birmingham for the last few years. It's a refreshing change, actually. The exhibition hall is very, very airy, and we're very fortunate to have our stand as principal sponsor of the NCRI in a very dominant position.
AstraZeneca have been coming to this conference now for 5 years, and we're supporting it as a major sponsor this year. I think as with any conference, the main thing is that it's about advancing science, and this conference has a real unique breadth in who it brings together, from academics to industry to clinical expertise. And I think we all have different remits in terms of our interests, but actually we have a collective goal which is about bringing benefits to patients, and that's where AstraZeneca comes in.
Well, it's a great opportunity to catch up on the latest science. It's also probably the only place in the UK where you can catch up with those people who are involved in the conception and delivery of clinical research in oncology in the UK, and therefore it's a great place to really get things done and start to forge new partnerships.
Well, this is one of the things about this conference. It does allow people from all backgrounds and all disciplines, and patients and families and friends, to talk to each other. And at the reception last night, we particularly welcomed a number of people from industry, from the science industry across the UK and beyond. And that's a great opportunity for them to network, to meet the people who are doing the research, and to begin to cement the relationships.
I think it's important that the Consumer Liaison Group does have a presence at this conference, because it helps to focus the minds on the fact that cancer research should be focused on patient benefit. In the last couple of years, a group of teenagers and young adults have emerged. This year they presented about the research that they've been doing, bridging the gap between patients, young children and young adults out in the community, and the Teenage Young Adults Clinical Studies Group, which is chaired by Jeremy Wheeler.
The TYA Clinical Studies Group was formed in 2005 really as in response to lobbying by a range of different groups, particularly those representing patients but also professionals, to acknowledge that there were issues that were very specific to the field of teenagers and young adults with cancer, including poor outcomes of treatment and a poor experience of care.
I'm a patient sort of representative. I'm involved in the group along with other young adults who've also experienced cancer, and we talk basically about research that's currently going on into young adults who've been diagnosed with cancer, but also we're here to encourage other young people to also get involved with research.
So I think people should come to this conference. I mean, I think people do, but we want more people to come. It's a great opportunity to hear about science, all aspects of cancer research, from basic to the clinical, to really interact with lots of colleagues, meet new colleagues, and really get enthused about the developments in cancer research, because it's a fantastically exciting time right now.